He turned water into wine, I turned whiskey into songs. Too many second chances, too many too far gones. Gave me grace along the way, took my heart and led me home. Don't you see, it's a God thing for me. Now I write songs about the heartland. My heartland's in Tennessee.
Welcome to the Heartland Journal podcast with Steve Abramowitz, editor-in-chief of heartlandjournal.com.
Howdy, y'all. Welcome back. I'm Steve Abramowitz, and this is the Heartland Journal podcast. On this show, we are focusing on our nation today with always an interesting person making a positive change in our community and lovers of truth, and this time a credentialed MD who loves truth. Oh my gosh, this is going to be good. Today we are talking with special guest Jessica Rose. Dr. Jessica Rose, Senior Fellow, Independent Medical Alliance, keyword independent, Computational Biology, PhD, MSc, BSc, no dummy, is a Senior Fellow specializing in computational biology from Canada. She holds a bachelor's degree in applied mathematics and a master's degree in immunology from Memorial University of Newfoundland and a PhD in computational biology from Bar Ilan University. Dr. Rose has completed 2 postdoctoral degrees in molecular biology from the Hebrew University of Jerusalem and a biochemistry from the Technion Institute of Technology. I am way in over my head on this one. She is best known for her contributions to public health and safety related to the COVID-19 injectable products and her analysis of pharmacovigilance databases like VAERS. Oh boy, here I go again, booking guests way out of my league in smarts. Well, let's see what some learning can do for the old boy and you. Let's meet the good doctor. With Fauci and CDC back in the news, you'll want to share this show with everyone you care about. Hang on. Oh, Dr. Rose, how are you today?
I'm doing great.
Where are you coming to us from?
How are you?
Oh, I'm good. Thank you for asking. Where are you coming from?
Israel.
Israel. Oh, wow. So it's early morning, late night for you, right?
No, it's like 6 p.m.
Okay. Okay, great. It's not even 9 a.m. my time, so we're good. So yesterday it finally happened. Trump just signed an executive order spacing out the children vaccine schedule. The executive order has been signed, but isn't up on the whitehouse.gov website yet. So we don't know exactly what is in the document. In my book, it couldn't have happened soon enough. What can you tell us about this executive order of Trump's, and do you even know about it?
Well, I can tell you that I know about it, and that's about it.
Okay. Is it a good thing? Is this something that can actually stick?
Honestly, my reaction to it all is kind of cynical. I don't think the president of the United States should be tasked with doing this kind of thing. And it's probably pointless for me to say this because, it is the way it is by design. The pharma monster has taken over, and the way that it's set up, the vaccine schedule, the children's vaccine schedule is, it's like, a steak on a barbecue for these people who are very aimed at making money, for a long time, liability
That's right.
free.
Yeah, that is right.
So it's just kind of a monster that's gotten larger over the years. I mean, all you have to do is kind of, I'm going off on a bit of a tangent here, but I'm trying to explain like why I feel cynical about it. Like, if you look around the world, most countries don't have anything close to the childhood vaccine schedule that America does. Not even Canada. I mean, it's kind of insane how many shots you're expected to give children these days, and it's unfounded.
upwards of 70, I believe, before they're 4. And I think the rest of the country is in the teens, 14, 15, maybe.
Right. And I mean we're talking about injecting infants that come right out of their mamas, like, and getting Hep B shots and vitamin K.
Right.
I mean, it's like there's no thought anymore in this. So the reason why I think I said that he shouldn't be tasked with something like this is because it shouldn't exist in the first place. I mean, again, it's kind of pointless for me to say that because it does exist and it needs to not exist. And this is, potentially the way forward to doing that. Let's all hope so. But it's just it's just about getting back to some semblance of sanity and normalcy. I mean, I was thinking about this on my walk today about it was there was this father pushing his baby in a little carrier, and he walked like a little faster than me on this path that I was walking on, and I noticed he was very um like type A attentive, because it was a very young baby, a new baby, and I thought to myself, like, if I was a new mom, I'd probably be just like him, like looking every 2 seconds, still alive, still alive, still alive. And
Yes.
it's like the miracle of those little meatballs that humans create. And then I got to thinking, like, um about these wellness checks and how basically all that means is like, here are the shots that I'm not even gonna give you an option not to get. I'm gonna guilt you into getting them because if you don't, you're gonna be killing all the other babies.
Yes.
And then I got to thinking about mama's milk and the whole evolutionary, concept of reproduction. It doesn't require all this shit.
Exactly right. Yeah.
So
I
it's
mean, the
like,
era of helicopter parents and this childhood schedule kind of came together as a perfect storm where they would actually freak out to say, like, oh my gosh, I must do this because science. Apparently, this one, and we can move on from it because neither one of us have read it, but it calls for greater parental choice. Okay, the same parent that's going to obviously do everything that they're told. Separate MMR shots. I think that's good. I mean, you don't want all that mercury in one day. More widely spaced vaccinations, same thing. Aluminum adjuvant alternatives. So I guess you get a choice. Do you want Coke or Diet Coke? And stronger safety monitoring. I don't know what that is, but I want to talk about that because safety monitoring, that was VAERS. What went wrong with VAERS during COVID?
nothing went wrong with theirs. The presentation that I'm preparing for the Allison inquiry is going, you know, as deep into theirs as I can go, to an audience of people who don't even know what it is. But it's been, I mean, it's a pharmacovigilance tool. It's literally all we have because, most of these products that they give out, even by mandate, are liability free. So all you can do is report your injury. And actually, if you're a medical professional, you are legally mandated to report even a suspected injury in association with a vaccine. And it's designed to serve as a safety signal detection system. So if you see a cluster of the same kind of reported adverse event in, say, a young age group or something, or a weird illness, a rare illness, then that comprises a signal that is detected using certain data mining tools. And then you're supposed to do a causality assessment to determine whether or not this is actually, causally associated with a particular vaccine. It works. It's been used for
Yeah.
exactly this process
I mean,
for
it's right there in the
years.
name, Vaccine Adverse Event Reporting System. Hello, that is your early warning system that the tornado is about to hit your house or that the flood is about to overbreak the levee. I mean, come on, that's what. How did they hide it in their emergency responses?
So it's exactly what I said when I testified at Senator Johnson's hearing like a couple of years ago in DC. You're not going to see signals if you're not looking. So nobody was looking. They not only weren't looking, they weren't acknowledging, and they weren't doing the causality assessment subsequent. So if they had been doing due diligence as they were when they discovered this intussusception signal, for example, in the context of the rotavirus vaccine back in 1999, which caused the withdrawal of that product from the market, if they had been doing that, just normal job, these things would have been pulled in January 2021.
I mean, it's one of the
because
first
there was a higher
indications I had as a
death
layman
signal.
that there was a problem. They were taking something that was tried and true and they were burying it. And that's how I found you, as a matter of fact, because of people who were actually saying, hey, this thing over here that we've had forever, the early warning system, you're not looking at it. You're telling us something totally different. So a new book, thank God we still have books, although Anthropic may be fixing that, calls it the Vaccine Mafia. Dr. Helmut Sturz's new book is a shocking expose on how the Pfizer BioNTech mRNA vaccine, quote unquote, was, with no proper toxicology analysis, injected into hundreds of millions of people. You know all this already. How could we let that happen?
Fear is powerful. I mean, with these recent disclosures and the ones that are coming, and I'm telling you, you guys, hold on to your freaking hats when those phone calls and voice messages come out, man, because you guys ain't seen nothing yet. There was a campaign to ensure that these shots went into as many arms as possible. If they'd had their way, and by they, I mean the people who are directly involved right now. I'm not talking about some, clandestine group in particular. I'm talking about the people who are like Fauci, the talking head, promoting all of this shit that he knew was not true. Yeah, I lost my thought again.
Let me ask you this question. If
Yeah.
you had walked into a classroom in 1978 and said that one day virtually every school district in America would have multiple classrooms dedicated to children who could not speak, who required one-on-one aids, who wandered, who self-injured, who had seizures, who would require lifelong care, they would have assumed it was describing some dystopian science fiction novel, or like One Flew Over the Cuckoo's Nest with Jack Nicholson. Profound autism didn't used to exist. Now it's everywhere. Can you tell us how you think this happened?
Yeah, I mean, environmental exposures to include vaccines, of course. This, again, I go back to compare the United States rates with the country you want to pick around the world. It's a phenomenon going on almost exclusively in the United States. Not exclusively, but almost exclusively. And again, one of the defining features, which does link it to vaccines, is the number of freaking products that are injected with various and sundry adjuvants, for your entire lifetime. They're absolutely inducing autoimmune conditions. I mean, come on. Again, look at the globe. It's not just the vaccines, I would guess. I think it's also the environmental toxins that we're exposed to all the time now, more than ever.
Well, didn't Japan do
From
this?
plastics.
Didn't Japan start the same process and then stop it? And so we can actually look and say, wait, why did their autism stop or go down, whereas America's keeps going? Isn't Japan a great petri dish to kind of get the point?
Well, they're always a great petri dish, quote unquote, because it's an island. Yeah, it's not even just that the rates are so much higher in America. It's like one in what is it, 1 in 31 or
That's
higher,
that's
depending
what
on
Peter
which state
McCullough
you look
said.
at.
Yeah, right.
Well, it's not what he said, it's what the rate is. I mean, I've done background on this and I looked at it myself. And yeah, the 1 in 31, that should make everyone want to vomit.
It
1
does.
in 31?
It does.
That's crazy. like autism can be very, very debilitating. I used to volunteer teaching surfing to autistic children, and you you find, you know, a variety of different versions. I mean, you could have high functioning, low functioning, physical, mental, da 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 da. You could be a savant. I mean, there's a huge range here. You could all, if you really wanted to go down the conspiracy hole, you could also kind of wonder if they're not, you know, experimenting with savantism. Um, but anyway, yeah, it can be very, very, very debilitating. I mean, Holly Tommy is a great example. Her son, she's had this experience firsthand, which is why she's so passionate about speaking out against this, because she's a mom. She knows. She knows exactly the moment the lights went out in her child's eyes. If you guys haven't watched all the Vaxxed movies, watch them. I mean, these are just normal people being, you know, given a platform to tell their personal stories about their own babies and the timing involved. And after you watch it, again, you'll want to vomit. But it's like, when does this not become freaking anecdotal to these people? I mean, and I don't know who I mean by these people, because there's so many middlemen right now in this whole machine, this industry machine. I mean, I'm not even sure the president himself would know how to stop this, you know, except for saying, like, you know, the vaccine manufacturers can't make money anymore, like,
Well,
or
if they
changing a
repealed
zero.
the if they repulled the liability waivers for pharma, that might change things a little bit if they could be sued out of existence. But
Mm,
instead, they're going the different route, and they want to give it to other industries like chemicals that we spray in the farms and stuff. So, one thing all Americans, Israelis too, especially school kids, have in common, vaccinated at birth or not, is stress.
mhm.
Research increasingly shows that chronic stress doesn't just affect how you feel, it can alter immune function and disease processes at the cellular level. We all have cells.
Of course.
Being a parent of grandparent or grandparent of a kid is hard, much less special needs ones. When I was growing up in the 70s and 80s, we didn't have autism. I don't think I knew a single
Nope.
person.
Nope.
What can you tell us about stress and its compounding effects on our health, especially since 90% of the world is under some kind of global war, whether it's from the media or on the ground, like Ukraine and Israel, obviously last year. So, well, every day, sorry. What's stress doing to this, the experiment that we just described and framed this whole conversation about?
Well, stress is the immune system killer. I mean, I've said that like hundreds of times. It's absolutely true. Um, you know, it alters production of hormones and the pathways associated. Basically, if you're in fight or flight mode all the time, like this, I mean, your cortisol levels are going to be off the charts, which can lead to a whole bunch of other downstream negative effects, aging, um, bad decision making, altering brain chemistry. I mean, hormones, people don't talk about them enough, man. You know, everyone hears the word hormone and they're thinking about testosterone and stuff. And it's like, no, man, hormones, they basically are involved in and control every single function in the body and organ. Um, so it's all connected, of course. And that's why I said that fear is so powerful, because, you know, they can plead ignorance all they want about how all of these completely unnecessary countermeasures um, were necessary, but they were not only not necessary, they ruined the world. There's no other way to say it. They ruined the world.
No.
Um,
No,
oh, I
I
imagine
know
there
people
are
that are scared to
millions of
leave their
people.
house. I mean, not just children.
Oh, that's what I was
Tommy
just
Lee,
gonna
the drummer
say.
of Motley
They
Crue, who
probably.
spent the years, chemically induced and going on tours and kissing all kinds of girls. He lives in a dark cave now because Howard Stern, it became a germaphobe. This thing scared the world, and they were willing to go on TV and tell everyone how scared they should be and were. Um, So you dug into it through the Fauci emails. I read your post about the Swiss company Demerouge and Dr. Fauci. What did you find that make it the quote unquote weirdest article you've ever written?
Because the name of the company that wrote an email to Fauci with completely redacted content was Demiurge, and Demiurge is not a meaningless word at all. And I'm normally writing about disclosures, analysis of uh, peer-reviewed journals, connecting the dots between like what's going on immunologically versus what shots are being delivered that day or whatever. Yeah, this one was weird because I don't know if people realize this, but uh the demiurge is described according to Gnosticism as the false god. I don't really want to get into this now because I don't want to offend anyone because I don't know my positions. I just want to, yeah, it was a weird article to write because of all the things that I needed to go explore from a research point of view in order to try and understand like what the hell was going on there. I mean, they didn't, as far as I know, there was no follow-up. They didn't team up with Demiurge or whatever, but that's almost irrelevant because of what they're doing, what this company does. They're AI, based, and they're pointing their let's say focus at healthcare. And primarily what they do is they make fake patients. They accumulate data, and then they make, predictions about, what's going to happen in the human realm, which I'm not even going to comment about how I feel about that, but because I don't want to offend anyone. But in any case, that was the least important of the many articles I've written on those disclosures by Rand Paul. Most of what I wrote about had to do with the proximal origin subject matter.
Yeah, so
And
tell us
getting to the
what
bottom of
else did
that.
you learn about behind closed doors with Dr. Diary that actually shocked you?
Well, it's more about what I learned about what the people who are absolutely instrumental uh, in what was going to be told to the public at the very beginning about all of this. That proximal origin paper was the centerpiece, if you ask me. Without that paper being published at the will of Collins and Fauci and Farrar, and what's that other guy's name? Christian Drosten, I think his name is, and the proximal origin boys. They couldn't have, the bucket wouldn't have held as much water as it did, because
Was
by
it a
doing
counter
that,
to the Great Barrington Declaration? Did they literally
no,
separate?
not related.
Okay.
No, that was separate. Um, Besides the fact that that was just written by a bunch of fringe scientists, epidemiologists, according to them.
Yeah.
No, that was separate attack. No, this had to do with making sure that there was no doubt in the public's mind, the public perception that the lab leak idea was completely ridiculous. And if you even thought that was a possibility, then you are a conspiracy theorist. And what the Slack messages and the emails revealed is that those guys were saying exactly the same things that the public were wondering about. Like, did this come from a lab? And was it engineered? And it absolutely was. I've been saying this for years. There are a number of us who've been looking at this every way you can, and there are actual fingerprints in this the coding material of the spike protein that could not have gotten there by
Yeah.
nature.
I remember learning all about
Uh,
the cleavage site and all this other things that I'd never learned in public school. That it was like, well, of course, how else could it have been cleaved if not by human intervention of some kind?
well, clear fear and cleavage sites are do occur naturally, but what was weird about this is the sequence of amino acids in that fear and cleavage site. And the fact that that particular sequence made the virus more infectious in humans. Um, anyway, so yeah, it had to be shut down. So all of those people are a part of it. Some knew more than others. I think the proximal origin boys, for the most part, maybe only Christian Anderson, were completely used, although he's not off the hook because he played a huge role in this. He was the handsome face of it all,
That's the
and
UK
he
guy
nailed
that
it.
came up with the chart that said a billion people were going to die or something of that nature. Is that the right guy?
No, I think Anderson's at La Jolla. Don't quote me on that.
Okay.
Anyway, um, yeah, no, he was just one of the primary authors. He's a really smart guy. And when he found out about the sequence of this fear and cleavage site, he was very, very concerned. And that's revealed in his private Slack messages with his proximal origin buddies. They were all really concerned.
Mm-hmm.
They were doing what we were doing to disclose how dangerous these shots were, like working 16, 20-hour days, 7 days a week for years. I mean, they were, if you're gonna ask someone to figure something out related to these subject matters, those guys are good ones to ask. However, you have to be not buyable.
Yeah. The same thing happened to
And I'm
Dr. Malone,
sorry to
who
say
invented the
this,
darn thing.
yeah,
I
they
saw,
they were buyable
I don't know if you've seen
apparently.
this yet, but I saw text. He said, Fauci, miscarriages could happen in first trimester. So he's a friggin' monster. He lied by withholding that and to Congress by saying 2% mortality, not 0.02 or less. What
Yeah,
what
I
should be
found
done
that,
to,
by the way.
yeah,
Don't listen
exactly.
to anyone else saying that they found that. I found that,
That's
and I
why
posted it when I found it.
that's why I wanted you on here. So what should be done to him? Should he lose his MD license at least? I mean, he's 85, so big deal, but something. He had data showing over 80% effectively an abortion shot. He said on TV, 20,000 pregnant women have been vaccinated with no red flags, his words. April 23rd, 2021, think back how what was going on then. Importantly, no safety concerns were observed for people vaccinated in the third trimester or safety concerns for their babies. Rochelle Walensky, did she say that because no babies made it to the third trimester? She was head of CDC.
Yeah. Well, Walensky was under a lot of pressure. I'm not condemning her yet. I think she should be punished for what she did, and I don't know what that means. I mean, she should have to answer truthfully. And perhaps if she does come clean, I think there should be a lot of lenience because I think she was under a lot of pressure. But Fauci knew exactly what he was doing because he's done this before. And I think he should be tried for crimes against humanity. I really do. I'm not the only one. I think he should at least have to answer basic
Are
questions
you
and
referring to
not
the AIDS
feel.
pandemic when you say done this before?
Mhm.
Yeah. Okay. Not everybody knows, so I just
I
wanted to throw
mean,
that out there.
cover-ups of tragic things that human hands or fingerprints are all
Oh,
over.
oh, the graveyard in
Um,
New York, in the Bronx with the black children, orphans. Yeah, I mean and the beagles, the dogs. He's done a lot of covering.
yeah, we're all beagles. Um,
They're all beagles
so
now.
yeah, he needs to somebody needs to get some balls and call all this shit out and put it into the public eye because the public can handle it. It's not only that the public can handle it, the public needs it.
Yeah,
The public needs
there's
a
so much
collective
injury out there,
fight.
they need it. And now the new AG has balls. literally. So we'll see if Todd Blanche decides to do what Pam Bondi wouldn't do in the first year and a half. So how in the world,
Mm.
after all we've seen, after all the confirmed injuries and even cases of death, Jessica, doctor, you found this, the safety data that definitively shows that more people died in the content of the mRNA 1010 injectable product than in the comparator group. The comparator group also were given a flu vaccine, not a saline placebo. Is this the new FDA approved flu shot?
Yeah, yeah. But I didn't find that. Everybody found that. It was right out in the open in their own goddamn data. What I did that was unique, that Aaron Siri would probably love, um, is I said, look, all these trials should be compared against actual saline placebos. You can't just compare it against a previous product that also is is associated with a litany of adverse events. You can't do that. Even though when they did, still more people died in the mRNA context over the conventional flu vaccine. But if you did, hypothetically, use a saline placebo, you would have to assume that no serious adverse events would occur and no deaths would occur in the context of saline, or even one. Let's be generous. And if that were true, then according to their data, which they just put out there that everybody saw and everyone's been analyzing, talking about, you were 30 times more likely to die
Mm.
on with their mRNA shot. This is just short-term data. This isn't long-term data.
I think it's in the
Like,
insert that comes with the box. Like it says all this. It's not a mystery. They're not even lying anymore.
well, that's part of the whole psyop, because now the reason why they did all this is because all of the vaccines to come will be based on this gene-based therapy with the LNPs. It's the convention now. They're even referring to it as a conventional mRNA product.
Lipid
There's no such thing.
nanoparticles,
Those
LNP.
words, they don't belong together. This is gene-based, um, pro-drug. I don't know. It's not a treatment.
DNA
It's
altering gene
not
therapy.
it's not a vaccine. It's something else. It's something, I don't know what to call it, injectable product, I suppose. Um,
So this is
but
an
yeah,
interesting
it's been
point. This is an interesting
normalized.
point. I hate to start to talk over you. I hate Zoom because that's the only way I can really have a conversation. But in the clip that I just mentioned on video, where Fauci said 20,000 babies, he also said, oh sorry, babies, that women that were tested and it was all okay. He also said monitored by FDA and CDC. How did the institutional capture get so out of hand that they'd even go along with poisoning us all?
Well, I can't answer that question. What I can tell you, what I know, is that somebody within the FDA who clearly had a conscience, and was an ethical human being, brought forth a new data mining technique that she had developed or co-developed or expanded upon, and it revealed that the existing system, which was this proportional reporting ratio, was masking a whole bunch of adverse events. So what I'm saying is that her technique revealed a lot more action in terms of adverse events. And it was, if you're actually concerned about vaccine safety, you should have taken that and said, you get a raise. Here's an article in the New York Times about your discovery, and we're going to run with this. But what they actually did was they told her to shut the fuck up, pardon my language, sit down in the corner and go back to your real job. And it was gone.
Yep.
Senator Johnson's been fuming about this since
It's
he
what they did to
discovered
Scott
this.
Atlas.
And
It's what they did to McCullough. It's what they did to
so
Malone. Every single doctor who's had anything to say other than what they wanted them to say got that treatment.
no, but I'm talking about internal.
Right,
So
right.
my point
A
is that there
whistleblower.
are good people. No, just there are good people within these institutions. Most of them are probably good, but the institutions themselves are run by appear to be maniacs, who don't seem to understand the words vaccine safety and the meaning behind that.
Hmm.
Like the whole thing is we want to make safe products for everyone who
Right.
gets injected, not some people,
Right. Safe and effective was the
to
standard.
help.
It was not safe nor effective. So it was literally not the standard of what they were supposed to have created in 200 years of precedent, I guess, since the polio, whatever that was, 150 years ago. So on May 3rd, 2020, we got to think back again to the very beginning. An email was sent as a I didn't even know they had email back then. Was sent as a response from Robert Gallo to Francis Collins, that was Fauci's boss, pertaining to a query to Dr. Kedlick. So speaking of maniacs, as you just said, suggesting using the oral polio vaccine OPV to prevent SARS-CoV-2. It makes me so angry. I think back to 2020, and even my kids have PTSD from this. They don't want to see doctors. They don't trust them. All of the unnecessary suffering, 6 feet apart, 3 masks, 5 masks, no masks, whatever, swimming with a mask on, the booster bullshit, the mandates, and now ineffective shots, the harms, all predictable. You wrote that. What are we doing wrong? Israel suffered this too.
Yeah, Israel was the first test bed. Anyway, it's a problem that we humans have in general. Especially it's especially noticeable now. We we think we've been convinced somehow through programming that we need an authority that isn't within ourselves. That's the base problem. Um, Even people who had like really strong instincts, like I don't feel right about this shot. I don't feel like they're standing in line about to get it, and they're like, I don't feel right about it, and they ended up doing it. You know what I mean? Like you cannot go against your own base instinct. You just can't do that. And that's, for the people who survived this, who are in, a little bit more who can see a little bit more clearly now, like never, never, never turn your back on your own feeling, intuition, uh, or self, because if something does go wrong, even hypothetically, like if you get an experimental shot and something F's you up, no one's going to help you. And I'm not just talking about like suing someone and getting money for it. Like, your body, it's too precious to be experimenting with gene-based technology with.
Mhm.
You can't do it.
They get
And
us
you
at our
can't
weakest moment. I
trust.
mean, in the emergency room, when you're not thinking clearly, you don't have your loved one there,
No, but
or the
that
children.
weakest moment was crafted. That's the thing. That's what I'm saying. That weakest moment,
The
world moment,
vulnerability.
was crafted. We were made to feel this fear on purpose. And any one of them who tries to deny it, and by them I mean the people who are being implicated right now with their own words by emails and phone calls, you cannot deny it. You knew exactly what you were doing and how scared everyone was, because you were getting tens of thousands of emails from everyone all over the world telling you how scared their people were because of you,
Do
because of
we,
what you said and what you stood behind.
so to go over their heads, do we need like a nuclear non-proliferation agreement to ban mRNA from the world? We know it's bad. It's like, don't stick your finger in the light socket, you'll get shocked, and you do it 3, 4 times to say, no, maybe next time will be different. How, I mean, RFK Jr., he was right? CNN was unable to cite a single study showing vaccines did more good than harm for children. My friend Steve Kirsch wrote recently, RFK Jr. challenged Dana Bash to name one study showing the COVID vaccine did more good than harm for kids who didn't even get COVID, by the way. She, of course, changed the topic, and even in the CNN article, they couldn't name a study. How do we stop this from ever happening again. I'm sure some baby was born last night and today that's going to get this shot.
Doing exactly what we're doing right now and never stopping. Talk, 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 talk. You know, people are always writing to me and they're like, "What? I'm so appreciative of your persistence. I don't know how you keep doing this after 6 years." And it's like, I'm more motivated and driven uh by this by doing what I'm doing than I've ever been, and I'm way better at it because I've had 6 years of practice. I've also had 6 years. I literally picked up a couple degrees in what I've learned from a genomics point of view. Anyway, yeah, I'm grateful in a way because I choose to be um for all of these awful experiences that have been thrown at us without giving us any options from any points of view. But I go back to what I just said. People, they are starting to realize in a much more global capacity that they've been brainwashed, mentally manipulated, and it's absolutely intentional, if you ask me. Docile
You called
people
it a
who
psyop
don't.
in the beginning. It's obviously propaganda. It's obviously lying. It's all the things that you would expect if somebody had an ulterior motive to what they're telling you, which was that this was healthy.
Well, the ulterior motive is just to control us, and the best way to control large numbers of people is through fear. It's the oldest tactic in the book. Best way to break up groups that you want to break up,
Mhm.
divide and conquer. Insert people who cause, arguments. And I mean, that happened organically with this stupid shot crap. Like, it broke up so many families. I talk to people every day who tell me the same thing. It's like, I'm still having trouble talking to my so and so because we don't agree on this and we never really patch things up. We're talking about blood. We're talking about families here.
Oh yeah.
You know what I mean? Like, what descended upon us is not was is very powerful.
I was
But we all have the ability to cast
yeah.
it out.
Yeah, as all this news unfolds, I think back to, obviously what was going on at the time and how we, in the beginning, we kind of scurried around and then the fog cleared and we got our kind of wits about us. And you said that the best disinfectant is sunlight to do what we're doing now, to talk about it and make sure we do this. But back on well, this was written July 30th, 2026 by John Leake. Banned by YouTube in 2021, we were right about everything. Reviewing and republishing my studio interview with Dr. Peter McCullough in May 2021 that was banned by YouTube. I just saw the following interview with then YouTube CEO Susan Wojcicki, Wojcicki, in which she boasts about banning 1 million videos from YouTube that her company and whatever tyrant it was consorting with decided were quote unquote dangerous misinformation. What did they do to your content?
Well, my content doesn't just include YouTube videos. I'm a scientist, and my mode of disseminating the outcome of my research is usually through peer review and journal publication. So I currently have one of our seminal papers under investigation because of these pub smear assholes. Um, you can just take my word for this, or you can go to Science Guardians on X and read their horrific and very true to fact um like information about this pub smear network and how they operate. um Complete nonsense. Anyway, so I've had a number of articles retracted without reason. One of them was this myocarditis paper that I wrote, which was literally just Here's what VAERS data is saying about myocarditis. Hey, there's a safety signal in 12 to 15-year-old boys that you might want to look at. And yeah, it was withdrawn in October 2021.
I'm actually
Not
shocked
soon
they
enough.
didn't unplug VAERS. I mean, if you can dig in there still and find it,
No, if they did that, I mean, come on now. The world would be like that would be something that if they did, everyone would wake up pretty fast, right? It's like
until
that
what are you going to do
all
about
we
it?
have is
It's like a data center
um
going up in your backyard. It's too late.
what would people do about it? They would stop getting vaccines.
They are technically. I mean, I've seen some numbers where they've kind of figured this out. Okay, I got a long question for you.
Hmm.
Hopefully you can bear with me. Obviously, my questions are long today because there's just so much detail here, and you're a doctor. Food supply. We live in a world where Google and Gates have genetically modified mosquitoes on the way, probably already with us. Ticks in Texas with alpha gel, data centers I just mentioned, already squeezing out farmland. That those things cause infertility with animals, they say. Well, they want to put them next to the Nashville Zoo where I live. So goodbye, future generations of zebras. Water, they're water hogs. Bezos, who owns Whole Foods and fake salmon. Gates, again, with fake meat, beef. In Tennessee, they passed a law you have to label lettuce injected with vaccines as medicine. But Taylor Farms from Arizona, the huge supplier to schools and fast food, they're now linked to this diarrhea lettuce. I don't know if you heard about that. But anyway, we're now eating a vaccine. That's a much different function than injecting it, mainlining it into your bloodstream. That's why the body will throw up food poisoning, right? I mean, so Bill and Jeff trying to corner the market on fake meat and modified insects instead of hypodermic needles to deliver it. Is this science fiction or is this the Brave New World?
No, it's not science fiction at all. They're doing all of this and more. I mean, people need to also realize like what we're allowed to see is what we're allowed to see. Um, and everything that's uncovered by independent researchers and journalists and even clandestine groups, it's hard to believe at first. You have to verify it for yourself using your own methodologies, because it's like that meme where the one person is standing in front of a million people, and the million people are screaming at him saying, "Do you still think we're all wrong?" And he says something. I don't know. I'm messing this up, but you get the idea. He's saying, "Yeah, I know you're all wrong." Anyway, yeah, this is also how we defeat tyranny, by standing up one by one. But yeah,
But what,
no, it's not science fiction at all. And I think there's a lot more science fiction going on than anybody is aware of, personally.
but would
Um,
eating it have the same function as jumping the blood-brain
no.
barrier? And when they inject it into a cow and it goes through processing and you finally eat it, digest it, it has to go through 20 miles of intestinal tract, stomach acid, all the rest. What's the point? Is it even going to do whatever mRNA is supposed to do, which I guess is create spike protein? You're gonna poop it out. And I'm not a doctor, so maybe that's completely ludicrous.
Uh,
But you don't
it,
digest every single thing that you eat. Some of it becomes waste.
well, most of it becomes waste, I would say, especially what people eat. I don't know. I haven't gone down this in uh, a thorough, I'll just say, way that I would feel confident talking about it. But I don't think we need to, because it's like, um, why the hell are these people doing that in the first place? Like, what are
Exactly.
they? My question would be, what are they actually putting into the animals? This, like I just said, like we're told what we're allowed to see and hear what we're allowed to see and hear. It's what we are not being told and what we are not allowed to see that really bothers me. Like, what actually freaking doing here?
Right, because we don't know what's in the
You
vial.
know?
And just because it's labeled as, COVID-19, it could very well
Exactly.
be graphite or any of the other things that they're trying to figure out, which we don't really know the end game because we're not privy to.
Well, no,
If we
it's
can make
I
everybody a
don't think
5G
it's that,
tower, we
but
can track them on flock cameras or something. We don't, I mean, who knows? Okay, so your Substack is literally called Unacceptable Jessica. I love
You
it.
don't have to do that because people have cell phones,
Right. Although you can leave it behind if you
by
really,
the
really
way.
wanted to. So get it into your skin, you don't have a choice. Um, but you're right. Your Substack called Unacceptable
People
Jessica.
will opt into that too, I guarantee you.
Oh yeah, it's coming. It's going to be injected right there in your hand. They already do it in Sweden, I think it is, or Norway, one of those countries. What was the moment of or piece of research that made you realize that label unacceptable was going to define your career, and why did you decide to wear it like armor instead of shrinking from it?
I would not say it defines my career, first of
Well,
all.
you called you titled your company that your Substack that.
It's not a company, it's just a blog. That I don't get paid for. It's just
Yeah.
where I write. It's where I dump my thoughts. And I just called myself that because it was at the exact same time that Trudeau was calling Canadians with brains unacceptable in their behaviors. So I was like, well, I'm unacceptable, Jessica. So it was just in reaction, a moment in time when I started it, like, that's a good name for me. And yeah, I've been, whatever, it's stuck. But yeah, this is just the Substack that I've had since this all started. And I mean, I'd love to think I have a future that doesn't involve all of this crap. Maybe I'll get back to doing science again, where I'm not actually trying to fight demons along the way. That would be nice.
That would be great.
Um,
Well, your tagline says
so
science, immunology, medicine. Three words that sound like they should unite everybody. When did you realize that publishing data in these fields from VAERS and whatever could turn you into like the enemy rather than a contributor?
I don't feel like an enemy. I am I suppose some people might say I'm a dissenter, but I wouldn't call myself that. I don't like labels in general. But I must tell you, I've been shocked and I still am at how mentioning VAERS data is what got me kicked off Twitter. Um, very quickly after I first joined, against my better judgment. I haven't been on Facebook, but I wouldn't have lasted long there either. I made a 1 minute video explaining how to calculate the underreporting factor for VAERS, just a stupid, boring math clip. And I wasn't even allowed to upload it because it got flagged.
Yeah.
And I've had videos removed from YouTube. So VAERS is like, the only reason I picked VAERS, by the way, was because it was the only database, like a vaccine database with related to adverse events that you could readily download. It's the only reason I didn't pick UDRA or Yellow Card or the Dane system or the CAFA system. Like, it's better. It's easier to use. That's why people actually use it too, I suppose, even though it takes 30 minutes to file a report and most of them don't get uploaded on the front end system, but it's still the best that we have.
Yeah.
So I didn't realize just actually showing the owners of the data what their data's actually showing would be so radioactive. No. And even today, when I post a chart that I make, raw data, no analysis, just always raw data from me. I still get these morons saying things like, you can't use theirs to prove causality. And I've said nothing about causality. That's why I just, prefaced what I said with, I'm only showing the frickin' absolute numbers and I'm not making claims. Here's a picture. What does it look like to you? You think. That's what I try and do. I try and get people to think for themselves.
Yeah.
Um,
That's a problem, actually. You've written about aluminum-associated neurodegenerative diseases, mRNA technology, and what you describe as, quote, the mangled, malformed protein risk. Which of your findings has surprised you the most, even as someone immersed in this data every day?
the human homologs in the spike protein.
Can you tell us what that means?
Well, for those of you who are suffering autoimmune conditions after getting even one shot, the likely reason is because your body is following up by attacking itself after being primed with antigenic targets in the spike protein that you were injected with. So within the coding material of the spike protein, there are little segments. We call them peptides, like shorter amino acid sequences or peptides, that have 100% homology, which means that they're 100% the same as some human proteins. It's called molecular mimicry. So imagine this scenario. You're injected with this shit. The LNPs transfect your cells. They dump their payload. The mRNA gets translated. Your cells are making spike protein and it's being released. Let's say it's circulating. Your body is going to mount an immune response against particular epitopes on those proteins. Very specific response against spike-related proteins, okay? Call them epitopes. Now, when the idea is that when you get challenged with the virus, that antibody response is going to come back to life after going dormant, after being, mounted for the original injection. And it's going to come and it's going to be like, hey, there's that thing that we recognize. Let's destroy it. Like that's the concept. But the problem is that because of the nature of the spike protein and the fact that it contains all of these strange peptides, including amyloidogenic peptides, or even if you want to say amyloidogenic-like, is that those antibodies and T cells and, the B cells that produce the antibodies that are specific against those epitopes, if they see, I'm using layman's terms,
Thank you.
that same epitope or sequence on a human protein, and if that human protein is really important, you get what I'm saying, right? Your own body is going to mount an attack, which is going to be persistent against itself.
Yeah. You've injected a foreign body that can attack you.
Well, what I'm saying is that spike protein that was engineered contains a lot of human homologs and a lot of sites that are going to cause immunological disaster, including a superantigen site, which basically means you're supercharging your immune system. You can die from that sepsis. It's got a lot of shit in there that shouldn't be in there, if you ask me. If this had been carefully designed, and even if it was crafted / engineered, it's strange that it's so potentially devastating in the context of the human being. That's what I'm saying. So that's what shocked me the most, because it's really hard for me to try and convince myself now at this point in time, after everything I've learned, that this wasn't engineered to be really dangerous.
Yeah, no, it's like shooting yourself in the head to do away with a headache. I mean, it's rough. It's not going to work. It never was. It wasn't intended to, apparently. So that's a perfect segue to this. Scientific consensus has historically been wrong before.
There's no such thing.
Well, they used to let us have phthalimide and Accutane and statins to the cholesterol heart disease hypothesis, all wrong. Do you think follow the science has become a dangerous phrase when it actually means follow the narrative? And should we be saying something else?
Yeah, I would say use your brain. Science is mutable. Science is ever changing. Science means challenging. Anything that's published, any study with questions. Science is grilling. Science is, fights in bars between brilliant individuals who have completely different ideas about the same thing, and then giving each other a hug at the end of the night.
Right. When Fauci called himself Dr. Science, he was obviously not representing science in any way, shape, or form.
No. I mean, everybody knows that was just, He was exploiting the illusion of authority, like I was saying before, to be the savior that everyone was looking for because they were so scared. I mean, he enjoyed that role thoroughly. We can see that in his diary,
Yeah,
which
complete
is kind of
narcissist.
gross
Yeah.
because a lot of people are sick and dying. Um, so yeah, I am a scientist. I'm an actual scientist. I explore any and all possible, questions within reason. Um, if I have a doubt about something, I will explore it to the end to gather a plethora of either supportive or unsupportive evidence. And if something is supported, then I file that in my knowledge base and it just gets bigger.
Hmm.
So that's science. If you want to call it something science, that is science, your knowledge base, based on discrimination, or discriminatory reasoning and skepticism as well. I mean, maybe I shouldn't say this, but today I was even wondering, I'll just tickle everyone's interest. I was rethinking the results of the double slit experiment, and I came up with an idea that kind of provides a different idea as to why we see what we see. But never mind. That's not what we're talking about.
Well, you are special in my mind because you, and probably a lot more people, I hope, but you've spoken about courage being what writers need to feed, not just inspiration. And you just told us about some inspiration you had this morning, and you just told us that. So, what's the most courageous thing you've published, and did you hesitate before hitting publish? Was it the courage that you have that made you actually publish it?
I suppose I'm courageous, but I think I'm just angry. And anger is really, it's an excellent impetus. Um, it's a great driver of action. Um, and I'm standing on truth. Uh, the truth of the stories of the people who exist who are suffering, and I'm doing this for them. So I don't think it's courageous at all. I think, I would define courage in another way, but I suppose, it is courageous to just, write something on a blog and post it. But um yeah, I don't know, I'm not afraid. I never have been. Not of some stupid zoonotic pathogen. Even if it was a zoonotic pathogen, I was never afraid because, you can face fear and you should face fear. And everyone has to do that in their own particular way. But like, um, I believe in the universe and I listen to, my intuition. I don't ignore, anything that I think is being signaled from within, or I try not to. Um, and yeah, it's just a pleasant way to live. I don't feel, I just feel normal.
Well, you're probably in the top 2% of humanity if you because of what you've done, but there's a tension between being a rigorous data scientist and a public advocate. How do you navigate the lines between here's what the numbers show and here's what I believe this means, especially when your audience desperately wants both?
Diplomacy. I was in the service industry for like 15 years, and it's the reason I didn't get into medical school, by the way. I got penalized um, by the university I applied to for being a part-time student during my undergrad degree, but I was working full-time, so I had to put myself through school. Um, and but I loved that time, and I tell you, man, when you're balancing an entire room full of really hungry people with kids, you learn really fast how to, first of all, be empathetic. Second of all, be extremely professional. Never take anything personally because it's not, all of those people are going through stuff. And I'm the kind of person that can see that immediately. I always have been that kind of way, but I honed it during those restaurant days. And
Mhm.
this has honed it even more. I mean, I honestly, I'm probably, instead of being lost on an island living in a cave, I'm probably going to end up being a politician, and I might even lead a country one day. I'm not kidding about that. Like, it's the last thing on the planet I would ever want to do. But you know how life is. Like, we often, there's a reason why that's the last thing I would ever want to do.
Yeah, yeah.
Um,
Well,
so
John
in
Kennedy
case,
wrote
you
a
know,
book called Courage. I had it in my mind just saying, profiles in courage. You would be a perfect example. We just talked about courage. You don't think you're courageous, but it's for us to decide if you're courageous, and you are. So you could be in John F. Kennedy's second book if he came back to life. So you studied COVID-19 vaccine adverse events from myocarditis to women's reproductive health. We talked a lot about it all. If you could design the ideal post-market surveillance system for future biotechnologies, because obviously the whole FDA testing and phase 1, phase 2 trials failing, not working, what would it look like and why aren't we doing it already?
wait, are you asking me how I would design a trial or how I would redesign the pharmacovigilance?
Post-market surveillance system for future
So very.
biotechnologies. Yeah, how would you fix it, or how would you incorporate it so that it becomes more of a standard that everybody looks to first, not last?
Well, I wouldn't. I think VAERS works fine. And it's like I said, it's because people aren't using it that it's not functioning. It's got
But
nothing
but
to
but
do with
VAERS has
how
to
it
be entered
works.
manually by a doctor telling their nurse or
So,
paraplanner to put it in there. What if they decided, well, let's just not because Dr. Fauci said we don't want
well,
ivermectin to be the cure?
that's on them. So we have to change, people from the inside. We don't need to change the system. The system is fine. It's not broken. It's
Hmm.
how people are using it. That's the problem. So it's a much larger task. We need to shift the mindset of the people. And I'm going to say this again, third time, like we have to come back to ourselves and realize that we are the authority. Nobody has any authority over us. Nobody. Not there's no such thing as a boss. I mean, you can make less money than someone else, but you're the best at what you do because there's only you. There's only one you. You're in this universe of people and things as a unique entity. And, you know, I would hope that everyone has access to the goodness of their heart because everyone has a heart.
Yeah,
Not everyone has a brain, if you ask me, but everybody has a heart.
right.
And yeah,
Lions, not
you
tin
need
men.
you need to be moral. You need to have ethics. You need to have guidelines for living that are compatible with living in a community of people.
Yeah. And that's my
As
point
as
is
a
that many scientists I've talked to on this show, they've watched colleagues self-censor out of this fear. Have you lost professional relationships over your work? And what do you say to junior researchers who feel the same call to investigate, but they are so worried that their career would be over before they start?
start your own company.
Mm. It's hard to pay your medical bills or
Um,
your student loans when you do that, but I guess it's possible.
why would you need student loans? That whole thing is fraudulent too. Like, the person I know who I love the most, who's the most successful in every single way you can be successful, is Kevin McKernan. And he just did it on his own. The guy's a genius, so he has a leg up, but he just created a genomics company. It's his. He owns it. And yes, he's extraordinary in many ways, but the primary way that he's extraordinary is that he knows, like who he is and what he's doing, and he knows he doesn't have to yield or wield to some fake notion of authority, like, and so he's writing the book. He just did this new sequencing technique, which I'm not going to talk about now, but it's called LiDAR. You can look it up. Um, And yeah, I don't know. I think people need to to reset. They not the great reset. I mean like reset their button and slow down and um take time alone. Uh get rid of the stupid phones, by the way. To just reassess, like ask important questions if you have the capability. I mean, some people just want to be non-player characters. Is that what they're called?
Yeah, yeah.
And go through the matrix and not really make a difference. And that's fine. That there's probably a reason why there's a lot of people like that. But for the people who are um just doubtful or fearful, like, no, I could never do those. Shut up. Yes, of course you can. That's what I would tell them. Of course you can.
Yeah. Well, it's people like you that do it for people like them. I mean, it has that consequence, the ripple effect. Your Substack bio says, "I am unacceptable." If the medical and scientific establishment woke up tomorrow and said, "You know what, Jessica, you were right about everything," what would be the first thing you'd want them to change?
Who are you talking about in this medical establishment? Are you talking about individuals or?
In the world that they've created that we live in now, what we've talked about for the last hour, how would you come back from like when Steve Jobs was fired at Apple and they brought him back and he made it the rule, not the exception? What would you change to make it never happen again, I guess?
Back the dollar by gold? I don't know.
Okay, well, silver does have
I don't
therapeutic.
know. Like
You can be healthy with silver too, so maybe that's the answer. I get it. Okay, I didn't mean to stump you. I just,
no, I
especially here
mean,
at the end.
I'm being serious. Like a lot of the problems that exist today, including this, the coming CBDC, which might actually be the reason why all this happened as well, um, is because, they can endlessly, the Fed can endlessly, or whoever is printing the money endlessly that is backed by nothing. It's monopoly money. And it's caused, like, in addition to everything else that we're going through with this COVID crap, it's caused huge problems in the world. And in my opinion, I'm not a financial expert, but it all started when gold was unlinked from the dollar. It's
Yeah.
not backed by anything, so it has no value,
Yeah, well,
no inherent
that is
value.
the theme of Goldfinger, the movie. So, which the last James Bond was the virus, so it makes sense. So, all right, as we come to the end here, the Roman Empire and lead. Are we sitting on all the answers to live as long as Abraham, my forefather, lived to age 175? The Bible says, he was 100 when he knocked up Sarah. But now we see sperm count at record lows in the West. Do we have the cure for cancer, erectile dysfunction, SARS, and everything else under the sun? No pun intended. But are we sitting on it because pharma can't make a profit on green tea and vitamin D and ivermectin?
Yeah, effectively. I mean, yeah, there's a history about all that too, like how we moved away from um or yeah, we did move away from one way of dealing with things by healing and more toward pharmaceuticals and doctrine. Um, yeah, if you don't know that history, it goes back decades, and it's
It was the switch from petrochemicals to from holistic medicine and basically
yeah, those
put
guys.
oil in everything. Yeah. Do we need a
Yeah,
new
exactly.
Declaration of Human Rights or just dust off the Nuremberg Code and Hippocratic Oath that seems to have been forgotten this era too?
Mm, I don't know. We need good leaders. I think that's the best answer I can give. We need
Yeah.
good, strong leaders.
And I fear as long
It's
as the
like,
profit motive remains, that's all fantasy. There are no human rights in outer
no, but
space, no Austrian economics, no capitalism, for example. So if we go to Mars like Elon wants, there'll be slaves. Hopefully, I'll be dead by then. Are you hopeful the medical institute, industrial venture socialism complex can be back to do no harm in the future?
I just hope as many human beings as possible assert their own authority. I don't know how else to say it.
It's well
You
said.
know,
I mean, the war on
I don't
inexpensive,
I don't
safe.
believe in pieces of paper that tell me that I have to behave a certain way. And I mean, they serve purposes. I'm not completely ignorant or naive to all of this. I know that the Declaration of Independence is important and I know why. But we as human beings don't need that kind of thing. We already have everything that we need to behave morally, ethically, socially acceptably. The problem is that we live in a society of depravity from every single angle. And, it doesn't take a rocket scientist to see that where you have depravity, where you have longing and wanting and needing physically, mentally, socially, psychically, spiritually, people are going to behave badly. So we need to balance that out. And we need leaders. We don't need better leaders. We need leaders.
Right, right. Not greedy
People
people.
who
Yeah.
who get that the valuable does not lie in a stupid fiat currency. It lies in, say, a tree, an old tree that's older than you and older than your children, that if it could talk would tell you stories that you wouldn't believe. So
Yeah. I mean, the
we need to
profit
make
motive
wisdom
seems to
cool
pit a
again,
wall with
man.
healthcare because there's this war on inexpensive, safe, broadly effective therapies. I'm amazed oranges are still for sale in the grocery stores. Thank God vitamin D is still free when it's not raining in Seattle. Uh,
If Gates has his way, he'll be blocking that out soon.
Yeah, he's working on it. He's already dusted it. Yeah. Well, Jessica, I could probably do this forever because you're a genius and I'm just me. But I want to
I'm
thank you
not.
for your time. Well, you're doing genius stuff, so let's just take that one from me. Tell our listeners where they can find out more about you and follow your social media so we can stay tuned and see if you do become queen of the universe, which I think you deserve.
I am the queen of my universe, first of all. You cannot find out more about me unless you get to know me personally, which requires geographic proximity. Um, yeah, just my Substack is where I post most of my things. I am on X. I have a decent following there, but I'm highly suppressed. And Yeah, I'm actually speaking at the Allison Inquiry coming up soon. It's an opportunity to give Canadian people who have been injured by the shots an opportunity and a platform to speak to members of parliament in Canada. It's very important. It's the first time, which is horrific considering it's been so long.
Yeah. Any
Um,
books coming
yeah,
out?
and yeah, it's coming up, and I'm going to be speaking about VAERS, and I'm going to be speaking about the lamentable Canadian adverse event data collection system, doing a little comparison, and also talking about the DNA contamination if I have time. Um, we've published 3 papers on that now. Sorry, that was three.
Three. Yes.
Three.
Awesome. Well, I want to thank you
These are
again.
3 fingers I'm holding up.
Only if you're vaccine injured and your eyes can't see that. That's she's holding for those on Rumble. That's a three-finger sign, not victory for peace in our time. All right. Well, thanks again
Yeah,
for coming on with us. There you go. Hang on, folks. I will be right back to close us out.
Now I write songs about the heartland. My heartland's in Tennessee.
Thanks for coming back. That is it for this episode. Share it if you like it. Thank you, Jessica Rose, Dr. Jessica Rose. Totally acceptable. My son used to say to me when he was a kid, if I told him to do something he didn't want to do, unacceptable. So, good dad that I am, I always shot back, totally acceptable. Now, do it. At least I didn't say because I said so, like my mom did to me. He's 24 now, very acceptable young man. But back to Jessica, who Liam may not even be around if it wasn't for people like her telling us the truth because of going through what we all did during COVID. She's one of the smartest people out there, and a crying shame they tried to cancel her. She's batting like 1,000 on things she said since Love in the Time of COVID and needs a Nobel Prize. I'm not a doctor. I don't play one on the podcast. She is. Won't ever come in her lifetime. The prize is totally illegitimate now. But at least the internet didn't totally disappear her, and you can see her stuff on Substack. Unacceptable, Jessica Rose. Totally acceptable. This is goodbye for now. I'm your host, Steve Abramowitz, editor-in-chief of HeartlandJournal.com. If you like what you hear, please subscribe and pass it around. Why wouldn't you? We got this kind of information. It's free. We only grow with your help. And thank you, WTN Nashville, Talk Radio 102.3 in Chattanooga, and News Talk 92.5 FM for airing my new show, America the Beautiful, every Saturday. More stations to come soon. Stay tuned. Hope you check it out. Peace in our time and glory to God. See you next time.
Hi, everybody. This is Dr. Jessica Rose, independent researcher, and I'm here to provide a call to action to sign the COVID Justice Resolution document. You can sign it at covidjustice.org. And the reason why it's important to do so is because the public at large needs to go more public about the harms and injustices that were enforced upon us or forced on us during the COVID era in the last 6 years. So I personally, I haven't gotten over, and I never will get over, the harms that were done to the people who were mandated to take the COVID shots, because I personally know a lot of people who are still suffering. It's not something that's gone away, like many people seem to think. Absolutely not. Many more people are still suffering, as I said. So I want to make people aware that this resolution exists, and I want to urge you to sign it. I already have, and let's make all of our voices heard and get some justice for, in my opinion, the people who need it the most are the injured, but for the population at large. Thanks.
I think all our society is run by insane people for insane objectives. You know? Yeah. And I think that's what I sussed when I was 16 and 12 way down the line, but I expressed it differently all through my life. It's the same thing I'm expressing all the time, but now I can put it into that sentence that I think we're being run by maniacs for maniacal ends, you know. If anybody can put on paper what our government and the American government, etc., and the Russian, Chinese, what they are actually trying to do, you know, and what they think they're doing, I'd be very pleased to know what they think they're doing. I think they're all insane, you know, but I'm liable to be put away as insane for expressing that. Yeah. You know, that's what's insane about it.
Yeah.
Love is a rose, but you better not pick it. It only grows when it's on the vine. A handful of thorns and you'll know you've missed it. You lose your love when you say the word mine. I wanna see what's never been seen. I wanna live that age-old dream. Come on, lass, we can go together. Let's take the best right now. Take the best right now.
We both lie silently still in the dead of the night. Although we both lie close together, we feel miles apart inside. Was it something I said or something I did? Did my words not come out right? Though I tried not to hurt you, though I tried, but I guess that's why they say every rose has its thorn. Just like every night has its dawn. Just like every cowboy sings a sad song. Every rose has its thorn. Yeah, it does.
It's a long way to Nashville from that Napa Valley vine. Put me on a road less traveled. Lord, now I know why. God knew I'd get there in His perfect time.
Heartland Journal Podcast is the media property of heartlandjournal.com, where you can find news stories, commentary, and content serving the heartland of America. Any views or opinions represented on the podcast are personal and belong solely to the creator and do not represent those of the people, institutions, or organizations that the creator may or may not be associated with in professional or personal capacity unless explicitly stated.
Now I write songs about the heartland. My heartland's in Tennessee. Now I write songs about the heartland. My heartland's in Tennessee.